Guys, I'm sure you've heard about the new visa, the health and care worker visa that was introduced in December 2021. This visa route is going to be like implemented on the 15th of February 2020. So we're talking about next week. If you don't know about this visa route at all and you're hearing it for the first time, go watch my previous video. I've put this description up here. To my returning subscribers, thank you so much for coming back again. Thank you for coming to listen to this girl. And if you're new here, I'm Fatima. I live in Scotland with my family, and I've been sharing tips on how to survive and how to live in United Kingdom or Scotland as an immigrant. And don't forget to subscribe to my channel. Don't forget to share with your friends. Don't forget to share with your neighbors. And also, please don't forget to click on the notification bell there, just so you can get all the you get notified when I post new videos. So let's get back to today's video. So because of my previous video, so many people have asked me so many questions about the health and care worker visa, and I thought it would be very nice to compile all these questions and come with all the answers I've got for all the questions you've asked me. So today's video is Q&A. Guys, you're going to be seeing me look down, and that's me looking at my laptop because I've kind of compiled all the questions. I don't know all of them offhand, and I want to be able to read them out so that some people can also benefit from these questions. Okay, so let's get into it. So number one question I was asked is, I have been applying to jobs on different job sites as well as LinkedIn, but so far I've not been lucky. Guys, I already mentioned that in my previous video, that if you're applying for this job, what's the first thing you want to do? You want to get your CV out there. And how it's not just uploading your CV. You have to make your CV attractive. I'm not saying you have to make your CV colorful. I mean, you have to make your CV be able to sell the person. You have to sell the person that you are. You have to make your CV speak for you. So when an employer sees your CV, they want to know, okay, this is the person we want for this job. This is the person that will suit this role best. So guys, if you don't know how to prepare CV properly, or you don't know how to prepare CV to UK standard, please go online, search how to prepare CV to UK standard, and apply for these jobs. Okay, let's go to the next questions. The next question says, will I be able to extend my visa, and does it count to settlement in the UK? Oh yes, very much. So that's why I said in my previous video that this visa road is the easiest ever to get settled in UK. So when you're on this visa route, it probably might be an initial 3 years visa that you were given, or it could be 5 years. But provided you've stayed in UK for 5 years, minimum of 5 years on this visa route, then you're qualified to apply for your indefinite leave to remain, provided you meet all the criteria. There are always criteria, but see guys, if you're on this visa route, there's nothing stopping you from applying for your ILR, definitely leave to remain, after 5 years. Okay, yeah. So let's go to the next question. The next question says, can I come with my partner or my children, and will my partner be able to work? Yeah, I also mentioned this in my previous video, that you can come on this visa route with your partner. I mean, you can come with your partner, and you can even come with your children. If you have 5 children, bring all your children. They can come on this visa route. But one person has to be the main applicant. So if you're a man and you got the job offer, then your wife will be a dependent on you, and your children will depend on you on your visa. So you're all going to have the same number of years of visa, and everything applies to them as well, except the job offer, which is fair, right? And also your partner can work full-time when you're on this visa route. So good. So let's go to the next question. The next question says, I have MSc. Another person did say I have BSc. So I kind of put them together because it's related. And do I still have to prove, do I still need a proof of English, which is the UKVI IELTS? See guys, UK Home Office says you need proof of English for this job, because if you're going to care for somebody, you have to be able to communicate. But if you've got your undergraduate or master's or PhD in UK university, then you don't need proof of English. Also, say for example, you've got your BSc, MSc, PhD outside UK, but is not part of the listed major speaking English countries. I mean, UK Home Office have the list of countries that are exempted. You can go to www.gov.uk to get this list. But I know that most African countries, Nigeria, Ghana, most African countries are not on this list. I understand we were taught in English, but you are not on this list. So if you're from these African countries are not listed, and you have an MSc or you have a BSc or PhD, what you then can do is, if you don't want to write IELTS, what you can do is you go to UK ENIC. It used to be called UK NARIC. You go to UK ENIC website. I'm going to be putting the link here. You go to UK ENIC website and do some what they call statement of result comparability. That means you want to compare your result. You want to compare your degree to that of UK. So what will you be needed for this? You'll be needing your degree certificate and your transcript. Also, you'll be paying for this service, and it's about £150 because it says 140 plus VAT. So that is what you'll be needing for this comparability result. And what happens after 2 weeks? You get your statement of result that says your result is comparable to the degree in UK. So that's enough for you to prove that you are from English speaking country, or that's enough proof of English for you. But say for example, we're talking about health and care worker visa, and I already mentioned that this visa does not require you to have a high qualification. Say for example, you're just like a A-level or an high school graduate. What you then need is you have to write this IELTS. But this is the easiest, because this IELTS Home Office, with this IELTS, Home Office is just requiring you to have a minimum of band 4, which is very, very easy. But guys, you don't just want to limit yourself to band 4. This is what Home Office says, but you don't know what your employer will want from you. Your employer might say they want 5. Your employer might say they want 5.5. So guys, try to go for 5.5. Okay, so let's go to the next question. And the next question says, which of the IELTS is required? Is it academic or general? The UK Home Office states that they require general UKVI IELTS and a minimum score of band 4. Okay, guys, that's what is required. The next question says, I don't have health-related experience. Can I still apply? Oh yes, you can apply. And I would say, see guys, if you don't have health-related experience or you don't have any care experience, it's just advisable just to give yourself a fair chance. You want to increase your chances too, because so many people are going to apply for this job. So we're talking about, say, like a medical doctor applying for this job or a pharmacist applying for this job. You want to kind of like increase your chance. What do you then do? Go for some training courses. It could be 3-month training courses. It could be 6-month training courses to get on this route. Okay? It doesn't mean that the medical doctor or the pharmacist is going to get it before you. And moreover, there are so many agencies, there are so many care homes getting people on this visa. So don't restrict yourself. Don't give yourself that fair opportunity to get on this visa route. Okay. Let's get on the next question. The next question says, if I end up volunteering in an health organization, will the reference letter from the healthcare organization be sufficient? I think it should be, because if you're volunteering, that counts as an experience for you, so that you can add to your CV, and if they need to verify, then they can contact that organization just to know if you actually work there or not. Okay, so your reference letter will be sufficient. Okay, let's go to the next question. The next question says, how do I get care home or agency to sponsor me? Guys, I did mention this in my previous video. If you've not seen it, go watch it. I've put it also in my description section how you can search for these care homes and agencies. I've even put in search words, like list of search words that you can put into Google to like help you to like get these jobs. Guys, go use it. If you've not been there, just go. The link is there. Just go watch it and see all the things you need to do. Okay, guys. Yeah, you will get this job. Don't give up. So let's go to the next question. Currently, I have a tourist visa of 2 years. Can this be converted to work permit? No, sorry, no, you cannot do that. If you have a tourist visa and you want to come through the health and care worker visa route, you then have to like apply through this route, and you have to meet all the criteria. Regardless of you having another visa, you have to meet up with all the criteria. Very important. So please, guys, make sure you reapply for a healthcare and care worker visa. Okay. So let's go to the next question. The next question says, are there any other visa route for those presently in UK and looking to convert to tier 2 health and care worker? Guys, there are so many visa options for you. So for example, you're in UK as a student. You know, as a student at the moment, you've got like 2 years post-study visa. So, for example, you're an engineering student, and after your MSc, you get a job as an engineer. So, guys, if I were you, you start looking for skilled workers visa to like sponsor you as an engineer. But fine, if you don't have that, if you don't want to go through that route and you want to go through this health and care worker visa, fine. Start looking for that job just like this. Make sure your CV is up to date. Make sure you meet all the criteria. You get the job under your post-study work visa. And after the 2 years, look for companies, or even before the 2 years, you can even get the company that can sponsor you on this visa route. So the moment the company sponsors you on this visa route, then it can eventually lead to your indefinitely leave to remain. That means you can settle in this country if you're on this visa route or another visa route. So it's very possible, guys. Okay, so let's go to the next question. The next question says, can I do additional work when I'm on this healthcare worker visa? Yes, Home Office did say that you can do an additional work, but there is a clause, and the clauses are the additional work must not be more than 20 hours. So don't forget, you would have gotten a job offer, and on your job offer on this health and care worker visa route, on your job offer there will be contractual hours. So you're contracted to like work 36, for example, as an example, you're contracted to work 36 hours per week, and you want to take an additional work. Make sure the additional work is not more than 20 hours. Guys, very important. Make sure it's not more than 20 hours, and it has to be a similar job. So if you're a care worker assistant or care assistant, make sure your additional work has to be a care assistant job, so they are on same occupational code. If, for example, for any reason you want to do more than 20 hours, then that means you have to reapply to Home Office. Okay, that means you have to reapply to Home Office, and that means the other company has to give you a certificate of sponsorship. Guys, very important. And if you want to do more than 20 hours as well, this is what you're going to do. You have to reapply. It doesn't really worth it. I mean, if you're doing about 60 hours a week, that should be enough for you to, like, you know, sustain yourself. Don't kill yourself with work. Okay, let's go to the next question. The next question says, can I go to school when I'm on this health and care worker visa? Oh yes, UK Home Office also states that you can study while on this visa, but also your employer has to know about this. And I feel there's a bit of clause to this, because just like previous, your contractual hours will definitely reduce if you have to go back to school. So that means your employer has to like contact Home Office to say, okay, we've sponsored this person to work 40 hours, and this person at the moment is working 20 hours. So I don't think it's really advisable. If you need to go back to school, then it's best to go through the student visa route. Okay, guys. So let's go to next question. I think the next question is my last question, and it says, "Can I travel abroad and return to UK when I'm on this visa route?" Oh yes, you can go anywhere you want to go, provided you get visa to like go there. So you can travel out of the country if you on this visa route. Say you want to even go back to your home country, like for visiting. Yeah, you can do that on this visa route. So yeah, go anywhere you want to go. Tell the world if you want to on this visa road, but make sure your employer knows about it as well. It's not like you're telling them your itinerary. It's not like you're telling them, "Oh, I need to go to Spain." But obviously, if you're working for a company, you have your holidays time. Make sure you book your holidays and make sure your holidays are approved before you kind of go. Okay. So, guys, I thought it would be worthwhile also telling you that when you're on this visa route, there are some things you should not do so you don't kind of like reduce your chances of like staying in UK or settling in UK afterwards, or say you want to extend your visa. And number one thing is you should not apply for any public funds. So when you're on this visa route, make sure you don't apply for any public funds like state pension, any other public funds. Very important. And number two thing is do not change job or employer. If for any reason you want to really change your job, then you have to reapply, and you have to apply. Make sure the other company that is ready to the other company is ready to like give you a certificate of sponsorship, and they are listed as company that can sponsor. Guys, this brings us to the end of this Q&A. Don't forget to subscribe to this channel, because I'm going to be giving you more and more information about UK. Don't forget to give thumbs up. Don't forget to, most importantly, share with your friends, share with your neighbors, share with your family members. Okay, till we see another time. Bye.